You guys familiar with that? That's John Imes out in Poway. And he did a relaxation technique to her, and a general relaxation technique that we get the Dora release, and then went down in the legs and did some technique down there. The more you can learn different techniques, the more you can integrate them. And so now he will be able to integrate what I do with what John does, and his work will get even better. There's no problem with that. So now we would want to, and your pain level is?
Right now?
Well, between yesterday and today.
It's gone down.
To a 1?
Yeah. But that was after Matt did what he did. After yesterday and being jostled around and stuff, it was pretty hot.
And show us just quick what you did.
I worked on the opposite side, right? Is it the left side I worked on?
You worked on you did this.
And there was the left sacrum, the left coccyx.
Yeah,
and the left gastric.
Yes.
Because you had all the work on the right, so the left side's probably trying to figure it out.
The left side's where my pain is now.
Right, but because you had that upslip, that's going to anchor everything anyway, so that had to get taken care of.
Exactly.
Because everything that I would have done would have been very temporary. So the upslip, because that can torque the dura all the way up to the cranium. So.
But what he did, you're absolutely right.
Right.
That changed the mechanics.
And then I just went to the left side and calmed down all the, superficial hypertension and all that stuff. The coccyx on the left was restricted, so I freed that up with a specific technique. And the sacrum wasn't moving quite as well on the left. And then I calmed down the leg. Yeah, I can demonstrate it if you like. It's up to you.
Alan, why don't you back up?
PRRT, it's called Primal Reflex Release Technique, whatever you'd like to say. It's the work of John Imes, he's up in Poway. And I'll go over what I did with her. I went to her master muscles are the most overused muscles in the body because we talk, we chew, we carry a lot of tension here. People with headaches, migraines, jaw pain, TMJ, they usually have pretty hot mess. This isn't bad today, is it? A little bit here, but that's a lot better. So what I did, stick your tongue between your teeth, bite down. And this is just a very general trigeminal dural release. And you tap the mylohyoid underneath the chin like that. She sticks her tongue out, bites down on her tongue. And you do several rounds of 12, 15 seconds with a discontinuous. I'm not just going boom, boom. It's just a... And what I'm doing is I'm trying to elicit the reflex. Okay? So I'm working with the stutter reflex and the withdrawal reflex of the body, using it as a treatment.
Stutter reflex?
Withdrawal and startle.
Startle.
Startle. Stutter. So that's better. And before I did this, what I had done is I palpated a couple things in her tailbone to get a general feel of how things are moving and to get an idea of what her pain level was.
Can you do that from the other side, Matt? Or,
yeah.
If you don't mind.
And basically, sacral bases, and I just do a little bit of a spring. And I'm feeling for tension, if it hurts, and if it moves, this for some joint play. Then I come down a little bit to the ILA, same thing, where's the sacrum. Then I go to the coccyx. And at the coccyx, you come underneath it and you spring it left to right. Okay? And there should be play there. And yesterday, there wasn't on the left side. And on the right side, it had pretty good play. So when I sprung this way, that was pretty good. And when I sprung this way, and that's a lot better. And it was pretty sore yesterday too, wasn't it? I mean, it was so what I did is I came down here and I did a general release. I also palpated this gastroc. Still a little bit tense, but it's not like it was yesterday.
I don't want to hit you like I did yesterday.
Yeah. So before she just came right up. And I also went into the adductors a little bit. The adductor magnus. What we find with that is that the adductor magnus is in spasm or hypertonic, the sacrum's usually twisted up. Yesterday it was, and that's not bad. So a general release of the lower extremity along with the sacrum, put your toes down for a close your eyes and relax, is you just elicit this withdrawal reflex of the toes. And what she's doing, she's fighting me. And I'm just trying to extend her toes as quickly as I can. Sometimes you have to open and close and do it really quick. And a couple 8 times.
So what is this doing, Matt?
And again, it's calming down the hypertonicity. This is also part of what he calls the primals. This was a primal release. This is a primal release. And again, it helps to affect the dura. To release the dura, because there's several muscles and ligaments that attach directly or indirectly to the dura. If you get those to calm down first, then you go back and see what's left for your major dysfunctions. Okay, here. And then what I did with the gastroc, hold this up, is I listed the patellar reflex and right on the anterior tib. Close your eyes.
Matt, what technique is this? What name if we were to...
PRRT.
What does it stand for?
Primal Reflex Release Technique. The website is THEPRRT.com. And this is John Iam's work.
So how long did you do this?
How long? I do 2-3 rounds of 15 seconds or so. And you just go boom, 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 boom. It's very quick. That calms down here. It also calms down to the foot. That's about all I did. I just went back, repalpated all these areas that were hypertonic, the sacrum, and again, I did do that. I forgot. I did
muscle
this.
energy over here to release the sacrum on the left.
I did this right here. This is a sacral coccyx release. You take the medial heel, you just have them hook it against the table like that. They push using their adductors with just a light amount of force. And what I do is I go above and below the knee, the tibial condyle, and the femoral condyle on the tibia, and I just gently tap, try to elicit a reflex.
I suppose.
Yeah, typically.
So she's just contracting into adduction?
She's doing an adductor.
Just an adductor isometric contraction. Just what's comfortable for her. Because some people will be in a lot of pain. You don't want to elicit that pain, just nice and easy. Now, people like me, I don't have a lot of pain. I can contract more. They can bam, bam, bam on me, and it's okay because it will release it more. But someone who's autonomically shifted, very sympathetically dominant, you have to be much lighter, more gentle. And this is where this work really takes off with. Okay? Several times, and then you're done, and you go back to the sacrum. Now, with these particular techniques, I hardly do muscle energy for torsions, anterior posterior torsions anymore, because this will correct it. But as it doesn't get to the soft tissue as much as what you're doing. So now I incorporate more soft tissue and really free the rest of it up. Because this works on a kind of a neuroreflexive level, and then Alan's work is working through the soft tissue level, the fascia, the viscera, to really make the changes so they're more permanent.
Yeah,
So that's
my experience with this. It works real well, but it doesn't hold as well.
Right.
And so if you can get this to release real quick and follow it up with the other stuff, that's just not much
Because
better.
if there's a fascial lock on it, you have to get into the fascia and unlock that. If you're lucky, they don't have a fascial lock, then boom, they're done. Then they won't have that problem anymore. But that's pretty rare.
Yes, that's
Unless it's with children. Treat a lot of kids, and they don't have those fascial locks because they haven't gone through enough trauma. And you can really open them up with this very, very, 1 or 2 sessions, they're typically done. There may be a couple other things.
What kind of symptoms they come
Headaches, falls, concussions, sports injuries.
Stress. John treated my granddaughter, who's a swimmer, and
she's older, so she,
Type
she
A.
has more. Yeah.
and just getting her, now she can self-relax herself, so to speak, with that business.
Because it hypes up the autonomic nervous system, and once you do that, everything else just... So this helps to free that up, and then you get to the other work. So fibromyalgia patients.
okay. That's, you can do that.
Okay.